Isolation Precautions, Chapter 17 in the textbook. Personal protective equipment, or PPE, is the barrier between the person and the disease. It's clothing or equipment worn by staff for protection against a disease. PPE prevents the spread of microbes. The PPE needed depends on the tasks, procedures, care measures, and type of precautions. Types of PPE are gowns, masks and respirators, goggles and face shields, and gloves. Gowns protect clothing and the body from contact with blood, bodily fluids, secretions, and excretions, worn with gloves and other PPE as needed. A gown must completely cover the body front from the neck to the knees. The opening is in the back and the gown is tied at the neck and the waist. Gowns are used once. Disposable masks are worn to prevent contact with respiratory secretions and to protect patients during sterile procedures. A wet or moist mask is contaminated. Practice hand hygiene before putting on a mask. To remove a mask, touch only the ties or the elastic bands. The front of the mask is contaminated. Respirators, or N95s, are worn when caring for people with airborne infection. Goggles protect the eyes from splashing or spraying of blood, body fluids, secretions, and excretions. Face shields protect the eyes and other areas of the face. The front of the goggles and face shield are contaminated. The headband, ties, or earpieces are used to secure the device are clean. Skin breaks on the hands and fingers are common and hard to see. Gloves provide a barrier. Consider the outside of the gloves to be contaminated. Apply a new pair of gloves for every person. Change gloves when moving from a contaminated body site to a clean body site. Put on gloves last when worn with other PPE. Practice hand hygiene before and after removing gloves. So the top left picture shows an individual with a mask, a face shield, a gown, and gloves on. The top right is an N95 mask. The bottom left is a respirator. The middle bottom shows a person with gloves, goggles, and a mask. And the bottom right shows a face shield and a mask. The word don means to put on. Doff means to take off. Isolation precautions are measures taken to control pathogens. They are based on clean versus dirty. Clean areas or objects have no pathogens. Dirty areas or objects are contaminated with pathogens. Isolation precautions are for residents who may be colonized or infected with certain infectious agents. They are protocols taken to prevent staff and resident exposure to pathogens. The CDC has two tiers of precautions: standard precautions and transmission-based precautions. Isolation precautions are necessary because blood, body fluids, secretions, and excretions can transmit pathogens. The isolation precautions provide a barrier. They also prevent the spread of communicable diseases. A communicable disease is a disease caused by pathogens that spread easily. Standard precautions were established by the CDC. It reduces the risk of spreading pathogens. It's what you do for every patient every time. Components include hand hygiene, wearing PPE when in contact with blood or bodily fluids, frequent cleaning of high-touch surfaces, and handling linens with minimal agitation. Standard precautions prevent the spread of infection from blood, all body fluids except sweat, as sweat is not known to spread infection, non-intact skin, and mucous membranes. For standard precautions, consider all blood, body fluids, non-intact skin, and mucous membranes infected. It's important to wear gloves when contact with blood, body fluids, secretions, excretions, mucous membranes, non-intact skin, and or contaminated skin is likely. Disposable gloves should be worn for direct care. Remove gloves after contact with the person. the person's setting, and/or equipment used in the person's care or other care environment. Remove gloves after contact with a person and before going to another person. Do not wash gloves for reuse. Change gloves during care if your hands will move from a contaminated body site to a clean body site. Wear a gown to protect your skin and clothing when contact with blood, body fluids, secretions, and excretions is likely. Remove the gown and perform hand hygiene before leaving the person's room or care setting. Do not reuse gowns. Wear masks, goggles, and face shields for procedures and tasks likely to cause splashes. Every patient or every situation, you need to wash your hands before putting on gloves and after taking off gloves. Do not touch clean objects with contaminated gloves. Immediately wash all skin contaminated with blood and bodily fluids. Choose appropriate PPE. Wear a gown if your body may come in contact with blood or bodily fluids. Wear a mask or goggles or face shield if there may be splashing. Sharp safety. Dispose of sharp objects in the sharp container. Never recap a needle. Finally, clean all surfaces potentially contaminated with infectious waste. Transmission-based precautions require wearing PPE. The type of PPE worn depends on how the infection is spread. So there are 3 types. There's contact precautions, droplet precautions, and airborne precautions. For all of these, disposable equipment is used when possible, or dedicated equipment, which means used for only one person, is kept in the room. Equipment that must be shared is disinfected after use. So contact precaution means that the infection can be transmitted by touching skin, wound infections, feces, and/or secretions. Put on gloves upon entering the person's room or care setting. Wear gloves to touch the person's intact skin. Wear gloves to touch surfaces or items near the person. Don a gown upon entering the person's room. Remove the gown and practice hand hygiene before leaving the person's room. Make sure clothing and skin do not touch potentially contaminated surfaces after removing the gown. There's also something known as enteric contact precautions, and those are taken to prevent infections that are transmitted primarily by direct or indirect contact with fecal material. An example is C. diff. Only soap and water kills the spores of C. diff. You can't use hand sanitizer with those patients. Some common infectious agents are MRSA, which is methicillin-resistant Staphylococcus aureus, VRE, which is vancomycin-resistant Enterococcus, and C. diff, which is a bacterium that causes inflammation of the colon, resulting in diarrhea and serious illness. Both MRSA and VRE are multi-drug resistant bacteria. They're indicative of serious illness. Next, we have droplet precautions. This is for infections that are transmitted by droplets from the mouth or nose. You don a mask before entering the patient's room, and for transport, the patient must wear a mask. Examples include influenza, strep throat, and pneumonia. Next, we have airborne precautions. That's when infections are transmitted through the air, such as tuberculosis or chickenpox. The room door is kept closed except when someone enters or leaves, and an N95 is worn. A red bag is a biohazard bag. It's a leak-proof plastic bags. Contaminated items are bagged for removal from the person's room. Biohazard bags are not disposed of with regular trash. Biohazardous waste includes items contaminated with blood, bodily fluids, secretions, or excretions.